Hi, my name is Terry Kuti. I am the founder and director of deepseafoundation.org. I'd like to welcome you to our educational channel where we talk about all options for breast reconstruction for those who have been affected by breast cancer and are facing a mastectomy. I am super pleased this morning to be able to introduce my guest, Dr. Joe Dusseldorp, who is a board certified, internationally trained microsurgeon over in Sydney, Australia. He's going to be talking to us today about breast reconstruction in Australia. Dr. Dusseldorp, waving across the pond, thanks for joining today.
Yeah, thanks for having me, Terry. It's really nice to see you again.
Yes, let's talk about what you're doing over in Australia in terms of breast reconstruction.
So yeah, it's something which, as you know, it's International Breast Cancer Awareness Month. And in this week, we celebrate breast reconstruction awareness. And so I think that's what stimulated me to get in touch and to want to have a chat, is to start to raise a bit more awareness about breast reconstruction in Australia and I guess internationally as well. Because we lag behind over here in terms of reconstruction uptake rates. You know, there was a recent survey published by an independent body here called the Breast Cancer Network Australia, or the BCNA. It's a fantastic organization run by breast cancer survivors. And they surveyed 3,500 women in Australia, and they asked them about heaps of different questions about their breast reconstruction, whether they received enough information about breast reconstruction before their mastectomy, what information they received, whether they decided to go ahead. If not, why not? If they did go ahead, were they happy with their outcome? It was a really interesting survey. And when you see data like that, you know, for multiple thousands of women, it's kind of this, you get a sense of what's actually going on. And I think it was unanimous, or at least one of the most highly sort of cited parts of the survey was that women did not feel like they got enough information. And so, you know, I kind of saw that and I thought, well, gee, I'm partially responsible for that. You know, that's you know, not on me individually, but I think all of us could do a better job at making sure there's better access to information, and women really hear the message that they have the choice to have breast reconstruction. Everyone in Australia should have access to it, even though there are, you know, factors in this report that looked at where those limitations might be, you know, particularly people in rural or regional areas, or people who didn't have private health insurance, or, you know, these kind of factors played into it. But the reality is that there is access, there should be access. Every woman who has breast cancer should be told there is an option of having their breast reconstruction. And that really, broadly speaking, I think there are three options. You and I sort of know this, but in Australia, women don't. That you can choose to go flat, you can choose to have implants, or you can choose to have your own tissue. And I think when we say it like that, it's simple, it's easy to remember. But it's when you meet people who are facing a breast cancer diagnosis, they don't know that. Still to this day, many of my patients who might be 5, 6, 7, 8, 9, 10 years into their breast cancer journey still don't know that. And I'm always like, at least if we can introduce that, it's one little thing that people just know there are three options, you know, having beautiful flat chest, having, you know, nice breast implants, or having your own tissue that's made to, you know, make soft breasts and breasts that feel more natural. You know, every woman has access to any of those three options. That's really the kind of message that I wanted to start to put out there. And I think it was, I think I was telling you earlier that I started to hear my own patient stories fed back to me. You know, after reading this survey, I thought, well, let's get more patient stories from our own patients and find out, do they feel like this? Did we do a good job? You know, did we give enough information? And actually, it was only through doing that I learned that even my patient, who was a 20-year medical journalist and an ex-nurse, didn't know what her treatment options were.
You answered your call to duty. Thank you.
Yeah, I think it was, yeah, I hope that everyone felt similarly, that it was just like shocking that, you know, in this day and age, we live in the information age, you know, your materials are so detailed and there's so much access, you know, through social media platform, anyone can access that. And yet even still, I think it stems, to my view, from the fact that women are, blinkered initially when they have a breast cancer diagnosis, and rightly so. It comes as such a shock that it's not the first thing that comes to mind. And breast reconstruction is definitely something that's put way down the list of priorities. The first priority being, for a lot of mothers and things, is to still be there for their children and their families and make sure they do, get rid of this cancer. And that's a totally natural feeling, and I think valid one. But I've even had to talk one or two women off that cliff, so to speak, who I could tell didn't really want to go flat, but were thinking they were just going to just get rid of their breasts because that was the way they were going to help their family. And I remember saying to one particular woman, it's like, you have to think about after breast cancer, after your diagnosis, after what's happening. Are you going to be, someone who feels comfortable in their own skin flat? Or is that something that you might be self-conscious of? And are you really going to be that mum that you want to be to your kids if you're not wanting to go to the beach with them, or you're not wanting to wear a swimsuit, or you're not, those kind of things you have to, I think people have to grapple with before they make these life-altering decisions. And so, yeah, that's kind of what I'm up to. It's not an easy task to get information out there, as you know.
No, it's not. And, we have had extra challenges the last 2 years just with the global pandemic, but you're using telemedicine. So let's talk about that real briefly, because that's access to information right there. Tell us how that works in Australia.
Yeah, it's been great. Our government's come on board. I was using telemedicine before COVID, at least trying to do it more and more, because I figured, particularly for regional patients, that option to have a discussion without having to get on a plane or get in a car and drive 6 hours, or find parking, and all the stuff that is a barrier to coming in and seeing a medical professional, seemed to me crazy not to use these kind of platforms to discuss things. Obviously, you can't do a physical examination and you can't have a full proper medical consultation, but for a lot of just information and sort of those shared decision-making steps, telehealth is great. So we've been using it for a while, but during COVID, it really took off, I think, because there was a lot of restrictions on who could come in. We still have to test to come in and see me in the clinic, go and have a negative COVID swab in my city, which feels like it's been a long time now that some of my patients have been doing that. But even vaccinated patients, it's still, because I work in a cancer center, we have patients undergoing chemo, and they're a high risk group. And so we're really vigilant about making sure people don't come in positive, even if they're vaccinated. So that's still going on. So, but yeah, I think telehealth has really come to the fore as a way of having in-depth conversations, without, and giving access to people who live far away. In my country, you can access services from other specialists who may live in another state or in another, geographical area. And I think that people don't know that. Even in the current era, they think, oh no, I have to stick with, kind of the person I was allocated to, and it's not the case.
Yeah, it's same over here. Sometimes, especially I think for microsurgery, the access isn't as available as a general surgeon or a general plastic surgeon, if you will. And to your point, Dr. Dusseldorp, all this education that you're providing through telehealth, education and all of that information takes a bit of time to process for patients. So even though you're not having, an in-person physical consult, this information that you're providing, I feel, is so important just for patients to absorb it, to let it sink in, because breast reconstruction is such a personal choice. You don't really know, until until you have all these options, what is it that is going to work best for me?
Yeah. And I think that's something that I try and get to, in the consultation at some point. Once people kind of feel comfortable, is to sort of ask, what people imagine their life to be like after breast cancer, because that's, really, that's moving on. That's really where we need to try and get people to, and then working backwards from there. I was like, well, what steps do we need to take to get to that point? And I think that's a really important step to get to, and it takes some time. A lot of people aren't ready to be thinking about that yet. It's kind of, they're still head down. They may still be going through chemo. They may actually, have just finished radiation therapy, or and it's it's a brutal pathway and journey. And I think we've got to recognize that for what it is. And I think you said today, like, not all breast cancer survivors want to be heroes, but there is an element of heroism in what everyone goes through, and sort of can withstand. The reconstructive journey itself is not always straightforward. There's challenges within it, but I think overcoming it is empowering as well.
Well, I think there's a certain amount of heroism in what you're doing. So I think the combined efforts of the patient and the surgeon is rather heroic in this day and age. And I think, part of the message here today too is for the viewers to, ask to have a plastic surgeon on your team when you're diagnosed. Because I know the day that I went in to find out with my breast surgeon if I was even going to have a mastectomy, she told me about plastic surgery. I didn't go in to talk to her about that, that day. So
Yeah.
I really want to thank you for what you're doing in Australia, because the message that you brought to us today, really, Dr. Dusseldorp, is universal. It's about education and providing what options there are for reconstruction. So thanks so much for joining us on the educational channel today. I have an invitation. Shall we dive a little deeper and have a podcast and do some more discussion on this?
I like what you did there. Yeah, definitely happy to dive deeper into deep surgery. That'd be
All
great.
right. Well, we'll put you on the schedule for that, and I want the viewers to watch that. But also, again, thank you for your time today and joining the Educational Deep Sea Foundation channel. Really appreciate it.
No problems. Nice to see you again.
You too.